Hi there, I'm Denise Stratton, and I'm a speech therapist and a myofunctional therapist. In this video, I'm going to give you an overview of myofunctional therapy and explain how it relates to speech therapy. There are four primary goals in myofunctional therapy. They are 1, to establish nasal breathing day and night, 2, to strengthen and tone the muscles of the tongue, lips, and face, 3, to promote the ideal oral resting posture of the lips and tongue, and 4, to establish optimal chewing, swallowing, and body posture. Now let's get into why we have these goals. Nasal breathing. One of the reasons we want to establish nasal breathing is because none of the other goals can be accomplished without nasal breathing. Without nasal breathing, you won't have well-toned facial muscles, you won't have a correct resting posture or a correct swallow. Nasal breathing is ground zero, and not just for myofunctional therapy, but for a boatload of health reasons. The second primary goal, strengthening and toning the oral muscles, makes it possible to rest your tongue where it needs to be, and to maintain a lip seal, and to chew and swallow in the best way. 3, to promote the ideal oral resting posture. The ideal resting posture is with the tongue suctioned to the roof of the mouth and the lips gently closed. It's important to understand that soft tissue can affect hard tissue. Our tongues are soft tissue, while the roof of our mouth, the hard palate, is bone or hard tissue. And where the tongue rests in the mouth can affect the size and shape of the hard palate. If someone has a low tongue posture while their face is growing, their palate is likely to grow in a more narrow, vaulted shape rather than a broad, domed shape. And a narrow palate can result in small jaws, which may not accommodate all the teeth without crowding. The hard palate is also the floor of the nasal cavity, so a broader hard palate results in bigger nasal cavities, which results in better breathing. And the other half of the ideal oral resting posture, maintaining a good lip seal, goes hand in hand with the tongue being up. If your mouth is open, your tongue will be resting low, and you will be mouth breathing. And the fourth objective, optimal chewing, swallowing, and body posture. A low tongue posture often means a tongue that is not toned, especially the muscles on the back of the tongue. And when this happens, the tongue tends to push forward against the teeth when swallowing and sometimes when speaking. And you may have heard the term tongue thrust. A tongue thrust can play havoc with teeth alignment, among other things. It can cause a lisp when speaking. So how does a myofunctional therapist achieve these goals? 1, we teach exercises to restore muscle function, and 2, we work towards helping clients remove obstacles. Some common obstacles are enlarged tonsils, chronic congestion due to allergies, tongue ties, thumb sucking, extended pacifier use, just to name a few. And you can see why a myofunctional therapist almost never works alone. In the myofunctional community, coordinated care is very common and almost always necessary. How are myofunctional therapy and speech therapy related? I'll explain that in a minute, but before I get there, I want to talk about the ripple effect of myofunctional therapy. The four primary goals I described may seem like a small part of someone's life, but the ripple out effect is really large. They can include better sleep, better posture, less anxiety, and this is because diaphragmatic breathing is associated with a different gas exchange than mouth breathing. Diaphragmatic breathing promotes calmness, while mouth breathing promotes fight or flight reactions. Better learning can also be a benefit. Some children who have been diagnosed with ADHD or learning disorders actually had their issues resolved when their myofunctional issues were resolved. Finally, let's get to speech. Better speech can be a byproduct of myofunctional therapy. For many years, speech therapists, myself included, have used various exercises to help children improve their speech. And while there is a little crossover between common speech therapy exercises and myofunctional exercises, a speech therapist is not automatically qualified to treat myofunctional disorders. A well-trained myofunctional therapist will have a solid understanding of how oral anatomy develops and plays a role in speech. And also the exercises a myofunctional therapist uses are much more rigorous than the common speech therapy exercises. Since becoming a myofunctional therapist, all of my clients with speech sound disorders have also had a myofunctional disorder. There have been no exceptions. And that's a pretty staggering realization and a strong reason to choose a speech therapist who is also a myofunctional therapist. I treat both myofunctional disorders and speech sound disorders, and at times the treatment will look the same, because sometimes all that is needed to correct a speech sound disorder is myofunctional therapy. If other therapy techniques are needed, I incorporate those as well. Myofunctional therapy is on the leading edge of healthcare, and I hope this video helps you understand it a bit better.